Hi Professor, my name is Jasmandeep and my student ID is 136299237, and today I'm going to demonstrate the head to toe examination, and here's a 360-degree view of my room. Hi, my name is Jasmandeep and I'm a student nurse. For today I'm going to demonstrate the head to toe examination as per your physician's prescription. Okay, so can I ask your name?
Divya Sachdeva.
Okay, what's your date of birth?
14 June 2001.
Okay, can I have your ID badge? Okay, thank you. And okay, are you comfortable with this?
Yes.
I'm going to perform the hand hygiene and there's a privacy. So the first step in the head to toe examination is the neurological assessment, so in which I'm going to assess your level of consciousness. So I'm going to ask you some questions. So Divya, where are you now?
At home.
Okay, so what's the time
Around 12 o'clock.
and who am I to you?
My student nurse.
Okay, and Divya, I'm going to this means that my patient is fully oriented to the time, place and the person. So now I'm going to assess for the perla. So Divya, can you focus on the wall? So I'm going to reflect light in your right eye to assess the pupil response, and again vice versa in your left eye. Now I'm going to assess for the consensual response. I'm again going to reflect light in your right eye to check the response of your left eye, and again vice versa in your left eye to check the response of your right eye. So now Divya, can you focus on the tip of the pen and try not to blink your eyes and remove move your neck? Okay, I'm going to. Okay, and this means my patient perla is equal. The pupils are equal, round, and reactive to light. And now Divya, I'm going to assess three signs. The first one is the facial droop. Okay, so can you raise your eyebrows, close your eyes, and smile for me? So this means there is no facial droop. And the second thing I'm going to assess is a slurred speech. You have to repeat three words with me. So the one, the drawer, bed, and the table.
Drawer, bed, and table.
Okay, this means there is no slurred speech. And the third one is a pronation drift. Divya, can you stand up? Can you do your arms like this, the palm side up, and can you close your eyes and repeat 1 to 5 with me?
1, 2, 3, 4, 5.
Okay, thank you. So there is no pronation drift, the patient is normal, and now I'm going to assess for the respiratory assessment. So for the respiratory assessment, I'm going to assess for any wheezing sounds, any labored breathing. So the inspiration and the respiration is normal, and I'm going to start from the apex of the lungs. So there are 10 landmarks anteriorly and 12 landmarks posteriorly. So I'm going to assess the 6 anteriorly and 8 posteriorly. Going to start from the apex of the heart. Divya, can you deep breathe? Can you move for me? Deep breathe. Deep breathe. Deep breathe. Now I'm going to assess the symmetry of your both legs. Deep breathe. Okay. Now I'm going to assess for the retrinital I'm going to assess for the tactile fremitus. Okay. So can you repeat 99?
99, 99.
So this means the patient is fully there is no labored breathing, no wheezing sounds, the strength is normal, and the strength is equal on the both sides, and it is 2+. So now I'm going to assess the cardiovascular assessment. In the cardiovascular assessment, I'm going to assess the 4 walls of the heart. The first wall of the heart is the aortic valve, which is on the second intercostal space right to the sternal border. This clavicle, first intercostal space, and the second one. This is aortic wall, and the second one is the pulmonary wall, which is on the second intercostal space left to the sternal border. and the third one is on the third, which is the ops point, which is on the third intercostal space left to the sternal border, and the fourth one is the tricuspid wall, which is on the fourth to the fifth intercostal space left to the sternal border, and the fifth one is the mitral wall, which is on the fifth intercostal space left to the sternal border, and it is on the mid clavicular line, and also apical pulse is also hearable. And now I'm going to assess the apical pulse for the 30 seconds. So the apical pulse is 40 beats per minute. Into 2, it is 80 beats per minute, and the pulse rate is 80 beats per minute. The rhythm is normal, and there is no wheezing sounds, and S1 and S2 is hearable, and no murmur is present, and no S3, S4 is there. And now I'm going to assess the abdominal examination. Can you lie down for me, Divya?
Can you please remove these things?
Yeah, for sure. Okay. So in the abdominal examination, I'm assessing your abdomen. There is no any lesions, any scars on your body, and no redness is there. And now I'm going to auscultate your abdomen. So I'm starting from the right lower quadrant, going clockwise to the left lower quadrant. So the vowel sounds are equal in the 4 quadrants. Now I'm going to palpate in the same manner. So yeah, so it means there is the vowel sounds are equal on the both sides, and there is no lesions, no scars on the body. And now I'm going to assess the integumentary system. In the integumentary system, again I'm going to assess for any lesion signs, scars, redness, and the discoloration on the body. As I already mentioned, there is no scars, no redness, discoloration on the body. And I'm going to assess for the temperature. The temperature of the patient is normal, warm to touch, and there's no cold sensation. And now I'm going to assess for the capillary refill. So the capillary refill time is less than 2 seconds, and the nail buds are pink in color. So now I'm going to assess for the skin turgor. I'm pinching the skin, and it compacts within less than 2 seconds. So it means the skin turgor is okay, it's normal. And now I'm going to assess for the pressure points. So there is no pressure points, no signs of pain, redness, or the pressure ulcers. So now I'm going to assess for the musculoskeletal system, in which I'm going to assess the muscle strength. Divya, can you up your arms and legs for me? Okay. And now I'm going to put pressure on this, and you have to resist, okay? Okay. This means the muscle strength is 5+, and the patient is having good gripping power. And now I'm going to assess the pulses, and the first one is the carotid pulse, which is next to the trachea, towards the sternocleidomastoid muscle. And I see here, and it is equal, palpable, and the strength is 2+ on the both sides. Now I'm going to palpate the dorsal pedial pulse, which is on the highest point of the first metatarsal bone. Can you remove your socks for 1 second? Okay. So the dorsal pedial pulse is on the highest point of the first metatarsal bone. Now I'm going to do the post-tibial artery, which is distal to the medial malleolus. And this means both the pulses are equal, palpable, and 2+. And now this is the 360 view of my room. Thank you.